I'm currently finishing up my master's degree with Dr. Craig Moore, and in his lab, one of the things, of course, is that this requires a lumbar puncture, so it's CSF analysis. So we're looking at biomarkers, right? So we're looking at, immune cell subsets, and we're looking at neurofilament light, but it's all in the CSF, which is, it's an invasive procedure. For us, it's not a big deal as a clinician to go ahead and do a lumbar puncture, but it could be quite an ordeal for a patient, taking the time out of their day. It's invasive. Some people have a lot of fear with regards to it. So what we want to do with any biomarker is to make it easy. It has to be ease of access. So one of the future studies that we're hopefully planning on doing is to make sure that we measure the serum, or the plasma rather, levels of all these immune cell subsets, as well as the plasma levels of neurofilament light. So we can use the Simoa platform to measure with high efficacy the concentration of neurofilament light. But we've actually recently secured a high sensitivity ELISA, and it correlates very, very, very well with Simoa measurements. So it has been fully calibrated, and you can actually measure concentrations down to a few picograms per milliliter, which is very, very exciting. So that's one thing we're planning on doing, is that in that same cohort, measuring the levels in the plasma. And what my master's project is focusing on is looking at serum or plasma neurofilament light levels in patients with relapsing-remitting multiple sclerosis, but seeing how that level actually is impacted specifically by different DMT subtypes. So high efficacy versus moderate efficacy. And the reason that we want to do that, of course, is to elucidate. Basically, the hypothesis, of course, is that people who are on high efficacy are going to have a lower level of plasma neurofilament light. And that's what we hope to see. And we should get results back on that pretty soon. And the whole real reason that I'm saying all this basically is that, there is a lot of indication that we could use these immune cell subsets and plasma neurofilament light as an actual biomarker longitudinally for patients. So it does have the potential to act as translational research and impact actual practice in the future. So we could, in the future, potentially not too far from now, use plasma measurements. So just a quick blood draw for patients as they come into the clinic, and use that as a means to say, measure disease activity and DMT responsiveness. So, because research has actually found that you can see increases in the plasma neurofilament light chain prior to clinical endpoints coming, obvious, like an EDSS increase or a relapse, or any overt findings on MRI. So current radiological markers. So it does have, it's exciting because we can use it, and it's something that's actually tangible that we can use for patients. And it would have actual clinical impacts because we could, see people having an increase in disease activity earlier and potentially intervene earlier for these people.